There's a concept that I want to introduce, and it's called differential diagnosis. In my videos, I've introduced so many different mental health disorders and so many different mental health related topics. You may hear some symptoms that overlap and think, which condition is it exactly? If some of these symptoms overlap between these different mental health disorders. That's where this concept of differential diagnosis comes into play. It's using the symptoms in that person's history to identify whether it's this condition, condition A, this other condition, condition B, or something else. In a video in the past, I introduced dependent personality disorder. And one person commented and asked, is this autism spectrum disorder instead and not necessarily dependent personality disorder? And yes, I do see the comments. Oftentimes I just still need to gather my thoughts. And then this has been a pretty interesting semester, but luckily I get to see a lot of the graduate students who I taught this semester walk the stage. So happy graduation to them. But back on topic, I do see the comments, and there was a person who commented on my dependent personality disorder video that this could be autism spectrum disorder instead. I'm bringing up these two conditions because this is a perfect example to highlight this concept of differential diagnosis. So with autism spectrum disorder, it is a condition that falls under the category of neurodevelopmental disorders. That means that the symptom was developed and that it was present during their developmental stages of their life. Hypothetically, if a clinician had to choose between only dependent personality disorder and autism spectrum disorder, again, this is completely hypothetical. Let's say the symptoms align so that it was only a clinician choosing between one of these two symptoms. That clinician would probably dig deeper into that person's history to find out if these conditions were present, to find out if this condition or the emergence of these symptoms were present during their developmental stage, because if so, that may likely fall under the category of a neurodevelopmental disorder, which would make this autism spectrum disorder. Again, in a hypothetical situation where they're only choosing between autism spectrum disorder and dependent personality disorder. Now, if these symptoms were not present or did not emerge or did not reveal themselves during the developmental stage, then it would be considered dependent personality disorder, because it would rule one condition out based on the history, the symptoms, and the evidence supporting that this other condition is actually the condition that someone is living with and not necessarily the other one. So again, it's applying their history, determining causality, observing the symptoms, and deciding whether it's condition A, condition B, or any other list of conditions that directly explain what is occurring with that individual. Now, this also occurs in the physical health world as well. So, folks may have to choose between which sort of physical ailment is impacting that person, whether it's a bug bite or whether it's some sort of staph infection, you name it, using the evidence that's there to determine which condition it is. Okay, so thank you so much for watching. Up next, I will introduce comorbidity or co-occurring disorders or dual diagnosis. Thank you so much for watching, and I hope to see you soon. Thank you.